In 1996, our chief scientific officer and scientific co-founder, Dr. Lawrence Lamb, was a transplant immunologist at the University of South Carolina, helping to manufacture products for leukemia patients undergoing transplantation. He was working on a program where 6 pediatric girls had recently undergone a bone marrow transplant in a desperate attempt to treat their disease that fall. In December, one of these girls, who was just 9 years old, gave Dr. Lamb this as a Christmas present. It's a little green wreath made out of puzzle pieces. Unfortunately, this little girl died on Christmas Day and was the 4th to have died from their cancer. Often doctors and scientists are expected and even trained to remove emotion from their work. But this experience really devastated Dr. Lamb and led him to tears in the stairwell of the hospital. He decided then and there to make it his life's mission to figure out what made a difference among the patients who lived versus those who unfortunately succumbed to their disease. During the early days, he noticed that the patients who had higher levels of gamma delta T cells exhibited a more than 3 times greater rate of survival than those who had low to normal levels of these cells. In the ensuing 25 years, a lot of other research has come out in support of his initial observations. As it turns out, gamma delta T cells are naturally equipped to distinguish between healthy tissue and tumor cells, making them an ideal candidate for targeted cell therapy. At IN8bio, we focus on harnessing and enhancing the innate abilities of gamma delta T cells to kill and eliminate cancer cells. This has allowed us to develop a platform that we call DeltEx that encompasses our ability to expand, activate, and genetically engineer gamma delta T cells at scale. Our unique approaches potentially allow us to intensify the fight against tumors in our efforts to eradicate cancer cells. We are driven by the potential of gamma delta T cells to fundamentally change cancer treatment by providing innovative therapies and approaches that potentially have greater effectiveness and are safer and more tolerable for patients who desperately need more effective options. Thank you for following us as we continue to push the boundaries of science in our fight to achieve our mission of Cancer Zero.